welcome to this explainer. If you've been dealing with unexplained knee pain, maybe some stiff hips, or an achy lower back that just absolutely won't quit, you might actually be looking for answers in all the wrong places. Today, we're taking a completely different perspective. We're going to look at this through the clinical lens of our orthopedic specialists at Westminster Multispecialty Clinic. At Westminster, our team really likes to look at the whole picture, and that starts at the very bottom. Because, as it turns out, the health of your joints is often dictated entirely by your feet. Here is our quick clinical roadmap for today's explainer. We are going to start with the foundation of movement, then compare flat feet versus high arches, explore the upward ripple effect, look at Dubai's unique footwear challenge, and finally discuss healing from the ground up. All right, Section 1, the foundation of movement, or as our orthopedic specialists want you to know, your foot is not just a platform. It is just so easy to think of your foot as a static block, right? Just this thing that connects you to the ground. But in reality, it's a remarkably engineered structure. Actually, nearly a quarter of all the bones in your entire body are located right down there in your feet. We're talking 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments all working in perfect concert. Its job is definitely not just to hold your weight. It's actively absorbing shock, it's constantly adapting to uneven surfaces, and it's efficiently transferring force upward with every single step you take. Now, when we look at the physics of that upward movement, it all comes down to force transfer. When your foot functions perfectly, well, that transfer is clean and beautifully distributed. The ankle, knee, hip, and spine, they all share the load evenly, and clean force transfer means happy joints. But when that foundational architecture is compromised, that force travels unevenly. Suddenly, the joints above your foot are forced to overcompensate. And trust me, over time, that constant compensation really adds up to significant discomfort. Moving right along to Section 2, flat feet versus high arches. Here, we're exploring the two very distinct ends of the mechanical spectrum. In our consultation rooms at Westminster Multispecialty Clinic, we frequently see two main structural variations that completely disrupt this delicate balance. So on one side, we have flat feet, clinically known as pes planus. With this, the inner arch is reduced, making the foot overly flexible, a bit too absorptive, and really prone to rolling inward. Then, on the completely opposite side of things, we have high arches, or pes cavus. These feet are rigid. They do not distribute shock well at all, which forces the heel and the ball of the foot to take the brunt of every single impact, and that often causes the foot to roll outward. So what exactly happens when you take these two foot types out into the real world? Well, at Westminster Multispecialty Clinic, what we see with our patients is that each structure brings its own specific set of risks. Say you have flat feet and you're running or maybe playing an intense game of padel. You are highly susceptible to plantar fasciitis, shin splints, and sudden knee discomfort. Conversely, the rigidity of high arches often leads to heel pain, metatarsal discomfort, frequent ankle sprains, and tight, really aggravated Achilles tendons. Which brings us to Section 3, the upward ripple effect, or why your back pain actually starts at your ankles. We all know how incredibly frustrating chronic knee or lower back pain can be. But let's look at why the root cause is often miles away from where it actually hurts. Okay, let's dive into this literal kinetic chain reaction. It's kind of like a line of dominoes falling. Imagine you have a collapsed arch. Step 1, as you walk, your foot rolls inward, a movement we call overpronation. Step 2, because everything is connected, your tibia, which is the main bone of your lower leg, rotates inward right along with it, and that violently twists the knee. Finally, Step 3, just to keep you from falling over, your hip and pelvis have to tilt to compensate for that twist. So, what started as a simple foot alignment issue has just completely physically misaligned your knee, your hip, and your lower back. The absolutely crucial takeaway here is that foot mechanics have very real structural casualties further up your body. When the knee rotates inward like that, it places massive stress on structures like the medial meniscus. Over time, this literally accelerates cartilage breakdown. Your hips then have to work overtime, leading to hip flexor tightness and gluteal weakness. And all of this often culminates in back and spine pain that no amount of stretching will ever fix. Because the pain isn't just driven by age, it's driven by mechanics starting right from the ground. Which naturally brings us to a really fascinating question. We've talked a lot about internal anatomy, but how does your external environment impact your feet? Let's take a look at the specific lifestyle factors we observe impacting our patients' joint health every single day. That leads us into Section 4, Dubai's unique footwear challenge. We're talking marble floors and minimal support.
Living in a place like Dubai creates some very specific environmental challenges for your foot health, and it's a reality our clinical team understands deeply. Just think about the indoor culture here. Beautiful polished marble floors are the absolute standard in our malls, our offices, and our homes. But while they look fantastic, these surfaces offer almost zero traction and literally no give underfoot. Walking on them for hours places a sustained, punishing stress on your plantar fascia and all those tiny, stabilizing muscles in your foot.
And when you combine unsupportive fashion footwear, or flip-flops, with those hard, unyielding marble floors, you basically have a formula for disaster. You are quietly accelerating the mechanical stress on your body. Now, if you have a perfectly neutral foot, you might get away with it for a while. But if you have a pronounced flat foot or a high arch, this combination is exactly what takes a minor structural quirk and turns it into chronic daily pain. All right, finally, Section 5, Healing from the Ground Up. Let's explore the Westminster approach to musculoskeletal care. Because the really reassuring clinical reality here is that these orthopedic issues are highly manageable once they're properly identified.
There is an old clinical saying that serves as the absolute core philosophy for our orthopedic specialists at Westminster Multispecialty Clinic. Assess the foundation before you treat the structure above it. It makes sense, right? If you've been treating a bad knee or a stiff back for years with zero success, it is probably time to look down.
So how does this translate into an actual treatment plan? Well, our team's approach is strictly conservative first. A thorough whole-body assessment might lead to custom orthotics, which are essentially insoles shaped precisely to your foot to redistribute that load evenly. We also heavily utilize targeted physiotherapy. This helps train and strengthen the muscles that support your arch and ankle, greatly reducing your dependence on passive support. And, of course, for more complex structural problems, our advanced orthopedic surgical consultants are always there to advise on the most appropriate path forward. So I'll leave you with this final thought to ponder. If you've been chasing pain around your body for years and years, is it possible the answer to your chronic joint pain is sitting right there at ground level? Sometimes, literally all it takes is stepping back and letting an expert look at the full picture. If you're ready to assess that foundation, our specialists at Westminster Multispecialty Clinic in Dubai Healthcare City are always here to help. Thank you so much for joining me for this explainer, and remember, good health always starts from the ground up.